When patients first learn they have type 2 diabetes, the first thing they want to know is it because I eat too much sugar? And the answer to that is not exactly. While diet plays a critical role in controlling blood sugars, it's usually much more complicated than that. There are problems going on at the level of the brain, and the muscle, and the liver, and the fat tissue, and the intestines, at the kidney, and certainly in the pancreas. So it's really much more complicated than did my sugar intake do this to me?
Some misconceptions that people have about type 2 diabetes is that it's a milder form of diabetes, that it's just a little bit of sugar. And we know that type 2 diabetes increases your cardiovascular risk. So it is a disease to be taken seriously, but patients often don't think it is the case because they don't feel unwell. They don't feel the high blood sugar.
When I encounter someone with that attitude, I try and shift away from talking about blood sugar, and I try to talk about what's important to them. Maybe not having dementia is important to them. Maybe keeping their kidneys healthy is important to them, and their heart healthy. Those are concepts that people understand a little more readily than blood sugar. And then we go back to the blood sugar issue and we link together how controlling blood sugar will help in those other areas. Not everybody with type 2 diabetes will need insulin, but many people will, and that's just the nature of the progression of the disease over time. If we delay insulin use because someone is kind of resistant to the idea, then yes, then the complications will follow. But if we use insulin early on when it's needed, we can maybe stave off the complications.
Type 2 diabetes can still occur in individuals who eat healthfully, maintain a normal weight, and exercise, especially if they have risk factors. Patients sometimes feel disappointed when they learn of a diagnosis of diabetes because they do feel that it's associated with, it's a matter of will. And of course, modifying your risk can lower your chance of developing diabetes, but it's also heritable. It's also your family history. It's also your ethnicity. All of these things play a role in increasing your risk of type 2 diabetes. But they can continue to adhere to healthy lifestyle measures to keep their blood sugars as normal as possible.